Okay, good afternoon, everyone. Thank you all so much for joining us today. My name is Tanner Gillette. I am the Assistant Director of Graduate Recruitment here at the UB School of Nursing. As a reminder, this is our post-bachelor's DNP FNP program and admission overview. We'll be going over all of the program ins and outs, as well as the admission requirements for our program. Dr. Molli Oldenburg is our program director. She is joining us today to talk about the program itself, and then a little bit later, I'll go over the admission presentations. This is being recorded, so if you can, for those that are here, just keep yourself on mute throughout the presentation. And at the very end of the presentation, we will stop the recording so that you can ask any questions that you may have. And with that, let's get going. Molli, or Dr. Oldenburg, I will turn it over to you.
Great, thank you. I'll introduce myself. I am Molli Oldenburg. I am the Family Nurse Practitioner Program Coordinator here at the UB School of Nursing. I've been a professor here since 2014. I work in both across programs in the undergrad and graduate program. I also still work clinically 1 day a week at Roswell Park on the leukemia service and their clinic on Tuesdays. And I'm also the Global Initiatives Coordinator here at School of Nursing. So I help to coordinate global immersion experiences for students to either travel within the States or internationally for global experiences for both undergrads and grad students. Good. So what is a family nurse practitioner? So a family nurse practitioner operates with autonomy and independence. I say that with enthusiasm now because New York is one of the states that allows nurse practitioners to practice independently after they've worked with a collaborating physician and have 3,600 hours of practice under their belt. They are able to open up their own practice and have a fully functional clinic independent without having a collaborating practice. And in New York State, a family nurse practitioner does have full practice, which includes the ability to evaluate patients, diagnose, order, and interpret diagnostic tests, to initiate and manage treatments, including prescribing medications, controlled substances under the exclusive licensure authority law. So that's the awesomeness now of the family nurse practitioners, that we can have full autonomy and independence. Family nurse practitioners serve as educators and advocates, not only for their patients, but also for families and the communities. There's a lot of versatility with obtaining your family nurse practitioner degree. You're very versatile with having the option to work in the hospital and across the entire age spectrum. So you're much more marketable having the family nurse practitioner, or working in an outpatient setting as well across the full spectrum. There's family nurse practitioners that specialize in cardiology, dermatology, oncology, which is myself, surgery, orthopedics, palliative care, nephrology. Family nurse practitioners work in both acute and urgent care centers. They can work in an office or a private clinic, a hospital as a hospitalist setting, skilled nursing or long-term care facilities, hospice center, correctional facilities, schools. They can specialize in working in just a women's health practice. So there's a lot of versatility with being family certified. Being a family nurse practitioner is, of course, a rewarding position, both professionally and personally, as we have that same feeling with working as a registered nurse. And there's a growing need for family nurse practitioners of all genders and ethnic backgrounds to work in both the hospitals and in clinics, as well as to establish primary care clinics with full autonomy after their 3,600 hours. So what are some of the duties of a family nurse practitioner? So patients will be seeing you, and you will be performing complete full examinations, whether it's focused or full physical, utilizing both your physical, psychosocial, and environmental assessment skills. Nurse practitioners order tests and for both acute and chronic conditions, and their responsibility is to interpret the tests and any follow-up that goes along with them. Communication of test results to patients and families, whether the results are good or bad. Prescribe pharmacological and non-pharmacological treatments, which incorporates developing a treatment plan that both is agreeable with the provider and the patient. Coordinating care with other healthcare professionals. It's very important, and one thing that we emphasize here in the program is interprofessional practice, where you know the healthcare professionals in your team and what their role and responsibility is for the patient. Counsel and educate patients about healthy lifestyle choices for disease prevention, and maintain and update medical records. As I stated, the patient population that a family nurse practitioner can see is from in womb to death across the entire lifespan. So generativity is that preconception and fetal period. Acquisition of capacity is early childhood and adolescence. Maintenance of function, that's your adulthood and middle age group. And then managing decline is the elder years and the declining body systems. Highlights of the profession, you are working directly with patients still, so you're able to give that direct patient care and establish rapport. And as a family nurse practitioner, in some situations, you're caring for entire families. There's a wide variety of patient populations that you can work with. You have career flexibility and stability, and teamwork with your interprofessional healthcare network. So for the family nurse practitioner program here at the University at Buffalo, will require you to complete a total of 97 credits. These 97 credits are spread across foundation courses, research courses, DNP core courses, DNP project and advanced practice courses, and your FNP specialty courses. These courses are sort of a combination of being in person and asynchronous, and some of them are online but synchronous. So the program layout and the length. So for the BS to DNP, it's the early assurance or new graduate. It is a part-time program, but it's considered part-time until you start your clinicals. When you start your clinicals, these courses are a 7-credit course. So whenever you start your clinical course, even though you don't, your semester total will not equal full-time credit load of 12 credits, you're still considered a full-time student at that point when you enter your clinicals. And I just bring that up because that is a time where sometimes students are able to then apply for more scholarships when they are a full-time student, because some restrictions are that the student has to be full-time to receive the scholarship. The program starts in the fall, and it has a graduation in the spring 4 years later. The clinical courses are only offered during specific semesters, so you have to follow the trajectory of the program. And once you start your clinical courses, after you've got your prerequisites for the clinical courses out of the way, the clinicals start in the summer, and then they carry on until your final graduating semester. And the reason that I mentioned that is that for some reason, as we know in life, both good things and bad things happen. And if you were to need to take a break, you would have to wait a full year to get back into the program if you are already in your clinical courses, because they are only offered during those specific semesters. And then we do have the full-time program, which is for somebody who has an active RN license, and that is a summer start and then a graduation in the spring 3 years later. I will mention one more thing about the program. Within the early assurance program, the first 2 semesters that you're in the program are all online classes. So that gives you the flexibility to work in your new RN role as a full-time registered nurse in the hospital or your choice of settings, and could take classes. It starts off at a milder pace with only taking 2 online classes in the fall, and then it ramps up to taking 3 online classes in the spring. This usually is doable for students as they're starting to learn their new job as a registered nurse as well. That summer is when classes then begin face-to-face, and some students at that point choose to reduce their workload as an RN to a part-time position if applicable, or they'll stay full-time, but that's when they choose to work like every weekend because they have face-to-face classes the following summer semester. So for clinical, the program in total is 800 hours of clinical, 750 hours are direct patient care where you will be hands-on with patients, and then 50 hours are simulation. The 50 hours of simulation are in your first clinical semester, and the feedback has been very supportive of this, in that we use sort of standardized patients, and we set up the simulations here on campus so that you're walking into a room with a standardized patient and getting some experience before you're actually out in the brick and mortar buildings in the community and entering the room with a patient for the first time as a nurse practitioner. And then the 750 hours of direct patient care, as I stated, start during that summer clinical semester. And then we find the value of being in clinical and having direct patient care every single semester up until graduation helps to support the fact that the program has 100% board pass rate, and we've had 100% board pass rate for 7 or 8 years at this point. We do have a clinical placements coordinator for the School of Nursing, which is one thing that's a bonus for the UB School of Nursing compared to some of the other colleges in the area where students have to find and secure their own clinical placement site. So we have a clinical placement coordinator that works with you and assigns you to a clinical preceptor for your first 3 clinical semesters. And those clinical hours, those semesters are 100 hours each semester. The very first semester, 50 of them is simulation, and then 50 of them is with a community partner and a clinical preceptor. And then the following 2 semesters are 100 each. And our clinical placements coordinator will place you with a clinical preceptor that meets the needs of that semester of what you're learning at that point for you to obtain those hours. We will place you in these sites, and they can be anywhere from up to 1 hour travel distance from the South Campus. And then after you complete those 3 semesters, you move into your project courses, because this is a doctoral degree, which does require you to do a DNP project. During your DNP project, while you're working on your research, you will also be in clinical during those semesters as well, completing 100 hours in each of those project coursework semesters. These 2 semesters, the clinical placements coordinator works with you to find that clinical site, because a lot of the time students want to be at a clinical site in the summer when they start their project coursework that reflects the population of what they're doing their project on. So if a student is doing a project on diabetes, they're more likely going to want to be in a primary care clinic as opposed to a specialty setting. Another student may be doing project coursework on providers' knowledge of prescribing birth control, so they may want to have their clinical placement site in a women's health practice. So the clinical placements coordinator will work with you for those 2 semesters to place you in a clinical site that works with you and your project. Your very last and final semester of the program is your 300-hour clinical semester. That is the spring that you graduate is when you will be in that 300-hour clinical. And this is the responsibility of the student to find their clinical preceptor for this semester. And we say that because we are always here to help you, and we will help you find a place if you can't find it. But a lot of times students have gone to multiple different clinical rotations during the program and have found a niche somewhere, and they may have had discussions with people in the clinic, and they may have a potential job opportunity. So a lot of times students find their own clinical preceptor and their own clinical location in that final semester because they have a potential job opportunity for the future. So we are still here to work with you if that's not the case, but we do emphasize that you try to find your own primary care location for your final semester of 300 hours. In that final semester, it is a total of 300 hours. We do recommend that half of those hours be in a primary care clinic because your boards will be on giving care in a primary care clinic. We do allow students to have half of those hours in a specialty area. If we have a student that knows 100% that they're going to be working in women's health, or 100% they know they're going to be working in dermatology, we allow them to do half of the hours in a specialized location, again, because they may have a potential job opportunity after graduation. Any of the clinical sites that are chosen, whether it's something that the clinical placements coordinator places you at, or it's a clinical site that you find yourself, all of these sites need to have affiliation agreements, and we will work on that on our end. I'm just saying that because it can't be the day before clinical and you say, this is where I'm going to go for clinical, because there may be a lot of work behind the scenes that has to happen for affiliation agreements. And some clinical placements require onboarding for students as well.
All right, awesome. Well, thank you for the program overview, Dr. Oldenburg. I'm going to now take it over, and I'm going to go over the admission requirements. And if there is a little bit of banging in the background, I do apologize. My office is in a very old building, and our heat sometimes makes the pipes clank a little bit. All right, so for our program, we require a Bachelor's of Science in Nursing. You must have your active US RN license as well. And then we require 3 letters of recommendation. Those 3 letters are submitted directly to us from the authors, and they should be written by someone with a graduate degree, a master's or a doctorate degree, or a healthcare worker that you've worked with in the past 5 years. It's very common for MDs to submit letters of recommendation. It's also very common for nurse managers to submit letters of recommendation, and they may only have their BSN. So as long as they fall into those 2 categories, you're good to go. We're pretty flexible there. We require a personal statement, which is it's 4 questions that you're answering in essay format. Nothing too crazy. We're just trying to get a sense of, you as an applicant, a current resume, and then transcripts from every school that you've attended. So what transcripts are required? To go a little more into detail, I know this is something that students always have a few questions about. So we must have official transcripts from where you obtained your BSN and if you have a master's degree. So those transcripts have to be official. We also need official transcripts from any institution coming from outside the United States. That's a university requirement. And then we can work with unofficial transcripts from every other school that you've attended. Nurses often have a few different schools that they have attended. But even unofficial transcripts need to have your name, the school's name, and if you have a degree from that school, it has to be on there with a GPA. I basically tell students that when they're looking for transcripts, or looking at transcripts to make sure if they're acceptable, they need to be clear and legible. You know your education better than anyone else, so make sure that you're looking at them before you upload them. And please do not include any screenshots of transcripts. The GPA that we require, this is something that a lot of students need a lot of detail on, and I completely understand. Post-bachelor's DNP students need a 3.0 overall GPA and a 3.0 nursing GPA. So we would look at 2 different GPAs at UB. An overall GPA is a combination of all of your credits and quality points averaged between the schools that you've attended within the past 10 years, with the exception of any nursing degree which never expired. So if you have an English degree from 2001, but then you found nursing afterwards, the English degree is not included in your overall GPA because it's well outside the 10-year time frame. On the other hand, if you got your nursing degree in 1994, that's well outside the 10-year time frame, but it's your nursing degree. So it's always going to be included in your GPA, your overall GPA. Your nursing GPA is all of your nursing specific courses plus some liberal arts courses that most nurses have completed. Examples of this are FNP 1 and 2, micro, chem, those types of things. While I have a list of liberal arts courses that we look at, we do not require that a student have all of them completed. The best two examples of this are sociology and pharmacology. Most BSN prepared nurses have taken a Sociology 101 course. However, some have not. I don't know that any graduate prepared nurse in the world would argue that you can't be a successful nurse if you didn't take a Sociology 101 course. The other is pharmacology. Every BSN prepared nurse in the world has taken a pharmacology course, but a lot of nursing programs will build it into Nursing 1 or Nursing 2, those types of things. So we know that you've had it, but it wasn't a standalone course. We're not going to make you go back and retake a course. So we see no benefit of making a BSN prepared nurse that's been practicing, that's passed their boards, go back and take an undergraduate course. It really just kind of delays the process for everyone involved. The GRE or MAT required? Nope, we no longer require the GRE or MAT for admission into any program, so you don't need to worry about sending them to us or taking them. And to go a little more into the application timeline, on December 15th, so in a little more than 15 days, the application for this program will open. Students cannot start an application prior to this date, even just to fill in their information. The application is tied to the specific program. So if you start to fill out an application and then change your program, it'll basically wipe the slate clean. On April 1st, summer and early assurance applications are due. So if you are an early assurance applicant or you're looking to start in the summer as a full-time student, you need to have your application materials all into us by April 1st. And on June 17th, fall applications are due. So that's for the traditional fall start, part-time fall start. Interviews. Students will be reviewed once all applications are complete. Basically, you will fill out the application, submit all your documents. I'll review everything, make sure that you meet eligibility criteria, and then I will send it over to Dr. Oldenburg. And if we would like to interview you for a space, we will email you to set that up. Interviews will last 45, 60 minutes, time roughly, and take place via Zoom. And then decisions are made on a rolling basis. So once your application, or once you've been interviewed, we typically are able to get admission decisions out, I'd say within 7 to 10 business days on the long end. So we can usually, the sooner you get your application complete, usually the sooner we can make an admission decision for you. With that, I am going to shortly start the recording, but if you're watching this in the future, please reach out to me if you have any questions about any of our graduate programs, and hopefully I see your application soon.